This is Jeff Close-Up, and I'm Carol Celine. My guest today is Dr. Jeremy Close. Dr. Close, after talking to you on the phone, I half expected you to come here with your skis and your snowboard. You were quite the athlete growing up. How many sports did you play?
I played quite a few. Growing up in Colorado and as a son of a football coach, it was kind of mandatory that you play sports. I played both football, track, and baseball in high school. Dabbled a little bit in rugby prior to an injury, and then regular outdoor sports, skiing, snowboarding, mountain climbing, a variety of things.
Were you ever injured?
No? Well, not until college, but yeah, quite a few injuries in college.
Did you ever do anything really dangerous?
Yes, while I was traveling through Europe one time, we did a bungee jump, my brother and I. It was roughly 590 feet in Switzerland. It was incredibly intense.
Were you terrified?
Absolutely, absolutely terrified. I planned on screaming the whole way down, and once I jumped out of the gondola, I couldn't even make a sound. It was just the wind whipping past me as I went down.
Oh, I can't even imagine such a thing. So now you have a little boy of your own. Are you already playing catch with him in the crib?
Of course, it's mandatory every day. Throw a few pitches to him, but it's going well.
So what took you into medicine? I mean, you could have been some sort of a professional athlete.
I got into medicine. You go, as a child, you just kind of say, I want to be a doctor. It seems like a great career. And then as I progressed through college, I really enjoyed the sciences. After graduating college, I kind of did the walk off the stage and was like, wow, that's done. Now what do I do? I started working as an orthopedic technician at a local hospital, and then ended up applying to medical school.
And you chose family medicine. Why family medicine?
I just like the broadness of the specialty. You can kind of do anything that you really want. You focus on multiple aspects of the patient, not only their health, but also their psychosocial influences.
Now, you practice sports medicine mainly at the Jefferson downtown campus, yes. But out at the Navy Yard, you concentrate on family medicine. Right. And I guess you see people from what age does your practice start?
Starts at 12 years old down at the Navy Yard, and then, of course, no limit at the top. And it's been a wonderful practice. It's a beautiful setup, and it's been a pleasure to be working down there.
And you get to see families as they age. Do you become like the family friend?
Exactly. You get to know them very well. Multiple people in their family. They refer people to you. You get to learn more of what's going on outside of the family, which can help kind of get you a better idea of what's going on medically, too, why they're not doing certain things or why they are.
Now, a lot of young people think, oh, I'm healthy, I don't need to see a doctor. What do you feel about the importance of annual checkups, and what age do you begin to get one of those?
I think it's a good idea to have annual checkups, especially if there's any significant history in your family of heart disease or cancers, just to make sure that you're getting the appropriate screening, keep you up to date on vaccines for preventable diseases, such as the flu, which we often miss.
Yeah. I'm very much aware of the epidemic of obesity in this country, and we have the president's wife talking about childhood obesity all the time. Do you think it is the doctor's role to get involved when you see an obese child? How far can you push people?
It's very important for the doctor to become involved. I think if you look at most patients, they expect that to be brought up by their physician because it is a medical problem, and they realize that. And so when you discuss the obesity with them, you're able to give them avenues for them to hopefully succeed in weight loss. It's a very difficult thing. There wouldn't be 5,000 weight loss programs and 10,000 medications and other things for patients if it was an easy thing to do. So you sit down, you chat with them, talk to them about diet and appropriate things they can do, and exercise as well.
We have a big push in this country for preventive medicine, especially with our new healthcare reforms. Again, how much can a doctor push a patient to get involved in prevention, or is it the patient's role to take responsibility for themselves?
I think as a physician you have to work as an advocate and know their background and work towards helping them do the right preventative things, discussing what their risks are, the benefits of things, alleviating their fears that they may have of certain screening tests.
But how far can you push, actually?
You can push as much as you want. I mean, you don't want to push too far that you make the patient uncomfortable and feel like you're lecturing them or belittling them. But it's something that needs to be brought up at every visit because it's important for their health.
Yeah. So you have to walk a fine line, yes. I guess.
It's a fine balance.
Well, thank you so much for being with us today, Dr. Close. It was a pleasure.
Thank you very much.